Alcohol is the third leading preventable cause of cancer in the United States, following tobacco use and obesity. Alcohol consumption contributes to roughly 100,000 cancer cases and 20,000 deaths each year. And a new advisory out today from the U.S. Surgeon General says alcoholic beverages should have a warning label about those risks.
U.S. Surgeon General Advisory is a trusted authority in public health, dedicated to raising awareness about preventable health risks. Recently, the advisory has turned its focus to the undeniable connection between alcohol consumption and cancer. While alcohol is often viewed as a harmless indulgence, the U.S. Surgeon General has collected life-threatening statistics that unveil its direct link to cancer. This vital information challenges the perception of safe alcohol consumption and underscores the need for greater public awareness. In today's discussion, we'll analyze the 10 most alarming statistics about alcohol-related cancer cases in the U.S. and worldwide, as highlighted in the U.S. Surgeon General Advisory. These insights reveal the widespread impact of alcohol on global cancer rates and emphasize the importance of prevention.
Well, it was very striking for me when I saw this data, and it became very clear to me that we have to tell people what the data is telling us and has been telling us more and more firmly for years, which is that there's a causal link between alcohol consumption.
Before exploring these shocking statistics, let's first understand why identifying alcohol's role in cancer is essential. Cancer is a devastating disease that occurs when normal cells begin to grow uncontrollably, forming tumors that invade tissues and spread throughout the body. Alcohol, while often overlooked, is a significant contributor to cancer development, especially in sites like the breast, liver, and throat. By understanding the profound impact of alcohol consumption on cancer risk, we can adopt lifestyle changes and policy measures to protect public health. But before we continue, this content is provided for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider for questions about your health or medical condition. Do not disregard professional advice or delay seeking it because of something you have read here. Now, join us as we uncover 10 alarming statistics that expose the reality of alcohol-related cancer risks and discover how these findings can guide us toward a healthier future. 1. U.S. cancer statistics. 2019.
Public, and the data would actually point to the fact that alcohol is a carcinogen and toxic to our cells, which means that it can cause DNA damage, lead to an increased risk of cancer, 7 different cancer types as the Surgeon General referred to, and also a host of other health problems as well. So we really need to be forthcoming with this messaging so that the public is aware that alcohol is simply not safe, and that we encourage patients to talk to their doctors, their family and friends about how they might decrease that consumption.
Cancer is a leading cause of death worldwide, and understanding preventable causes is critical for saving lives. Alcohol, widely consumed globally, is a significant yet often overlooked risk factor. This makes it vital to highlight its alarming role in contributing to cancer cases. In the United States, alcohol-related cancer cases have surged, with men and women both impacted significantly. Many people remain unaware of this connection, leaving them vulnerable to preventable cancers. Research has shown a direct causal link between alcohol consumption and increased cancer risks, but public awareness is shockingly low. In 2019, an estimated 96,730 cancer cases in the U.S. were directly tied to alcohol consumption. This included 42,400 cases in men and 54,330 in women, emphasizing the widespread impact of alcohol. These numbers are not just statistics, they represent lives profoundly affected by preventable cancers. By reducing alcohol consumption, we could potentially prevent nearly 100,000 cancer cases annually in the U.S. alone. Second annual cancer statistics. According to the U.S. Surgeon General Advisory, thousands of families are impacted by the devastating loss of loved ones due to alcohol-related cancers every year. With cancer deaths soaring, understanding the risks is crucial. Alcohol-related cancer deaths significantly exceed other alcohol-associated risks. such as impaired driving fatalities. Despite this, public health efforts often fail to emphasize alcohol's role in cancer mortality, leaving individuals unaware of the stakes. Each year, 20,000 Americans die from alcohol-related cancers, surpassing the 13,500 annual alcohol-impaired traffic fatalities. Addressing alcohol consumption could save thousands of lives and restore precious years. Third, global cancer burden, 2020. Cancer prevention efforts often focus on smoking and diet, but alcohol consumption is another major contributor that often flies under the radar. Its global impact on cancer incidence highlights an urgent need for awareness. Worldwide, alcohol consumption is responsible for a significant portion of cancer cases. Even moderate drinking contributes to this burden, disproving the notion that low levels of alcohol consumption are harmless. The global numbers reveal the true scale of the problem. In 2020, 741,300 cancer cases globally were attributed to alcohol consumption, with 185,100 cases linked to drinking, 2 drinks or fewer daily. This staggering figure underscores that even moderate alcohol intake significantly raises cancer risk. Public health initiatives emphasizing the dangers of alcohol are crucial to addressing this global crisis. Before we move on, if you are looking to dive deeper into the causes of cancer, be sure to subscribe to the QuickTime newsletter linked below. Each week, we share expert-backed tips, delicious recipes, and actionable steps to help you live longer and feel your best delivered right to your inbox. 4. Years of life lost. When discussing the devastating impact of cancer, it's not just about the number of lives lost. It's also about the years of life stolen. Alcohol-related cancers are a preventable tragedy, yet they significantly shorten lives, leaving families grieving for loved ones taken far too soon. Understanding this metric is essential to grasp the true cost of alcohol-related cancer deaths. In the United States alone, alcohol-related cancer deaths claim thousands of lives every year, but the impact goes beyond mere numbers. These deaths often occur in individuals who are years or even decades away from their natural life expectancy. Despite evidence linking alcohol consumption to various cancers, public awareness and prevention efforts remain insufficient. The loss is not just individual. It affects families, communities, and society as a whole, highlighting the urgency to address this preventable issue. Each year, alcohol-related cancer deaths in the U.S. lead to 305,000 years of potential life lost, with each victim losing an average of 15 years. These figures illustrate the devastating human cost of preventable cancers. By reducing alcohol consumption, we can not only save lives but also preserve precious time to create memories, contribute to society, and live fulfilling lives. 5. Breast cancer in U.S. women.
So, we know that alcohol is toxic to normal, healthy cells and can cause DNA damage. But with breast cancer specifically, it can also affect how our hormones behave. And in many instances, breast cancer is hormonally driven. It can also affect how our healthy cells absorb nutrients that we need. It can also lead to excess weight because it's calories, empty calories.
Breast cancer is one of the most common and devastating cancers affecting women worldwide. While many focus on genetics and lifestyle, the role of alcohol in breast cancer cases is often underestimated. According to U.S. Surgeon General Advisory, breast cancer accounts for the majority of alcohol-related cancer cases among women. Studies reveal that even light drinking can increase the risk, making alcohol a significant modifiable factor in breast cancer prevention. In 2019, 44,180 alcohol-related breast cancer cases occurred in the U.S., making up 16.4% of all breast cancer cases in women. This alarming statistic highlights alcohol as a major preventable factor in breast cancer. Reducing alcohol consumption could dramatically decrease these cases, saving thousands of lives each year. 6. Alcohol and multiple cancer types. Cancer risks are influenced by various factors, but many are unaware of how alcohol consumption increases the likelihood of developing multiple types of cancer. This lack of awareness is a critical gap in public health education. Scientific research has firmly established that alcohol consumption is directly linked to cancer at several sites in the body. This risk exists regardless of the type of alcohol consumed, and it starts to increase even at low levels of intake.
We've seen data now building for years that's telling us that there is a causal link between alcohol and 7 types of cancer, including breast cancer and colorectal cancer.
Alcohol consumption is causally linked to 7 types of cancer, including breast, liver, colorectal, esophagus, mouth, throat, and voice box cancers. Even drinking as little as 1 or fewer drinks per day can raise the risk of cancers like breast, mouth, and throat cancer. Raising awareness about these risks is essential for cancer prevention efforts. 7. Cancer deaths within recommended limits. Alcohol consumption guidelines often aim to promote moderation, but even drinking within these limits can lead to severe health consequences. This makes understanding the risks essential for informed decisions.
Well, the more alcohol, the greater the risk. It's hard to put the exact number of, the increased risk based on this amount of alcohol. They tend to divide it into less than a drink per day. And then if you have a drink a day, 2 drinks a day. And right now, the recommendations, they say, well, a woman, shouldn't have more than a drink a day and a guy shouldn't have more than 2 drinks a day. But that may need to change.
While many believe staying within recommended limits protects them from harm, research shows that even moderate alcohol consumption contributes to cancer mortality. This challenges the perception of safe drinking levels. According to the U.S. Surgeon General Advisory, a shocking 17% of alcohol-related cancer deaths in the U.S. occur among individuals who drink within the recommended limits of 1 drink per day for women and 2 drinks per day for men. This statistic underscores that no amount of alcohol is entirely risk-free when it comes to cancer. 8. Unawareness of risk. Public health campaigns have successfully highlighted the dangers of smoking and obesity in causing cancer, but alcohol's contribution often remains underemphasized. This disparity leaves a significant health risk unaddressed. Surveys show a troubling gap in public knowledge about alcohol and cancer. While awareness of other cancer risk factors like tobacco and radiation is high, alcohol remains underestimated as a carcinogen despite mounting evidence. In 2019, only 45% of Americans recognized alcohol as a cancer risk factor, compared to 91% for radiation, 89% for tobacco, and 53% for obesity. This persistent lack of awareness highlights the urgent need for stronger education campaigns to inform people of the risks and encourage preventive measures. 9th, global disparities in awareness and action.
The U.S. Surgeon General is calling for cancer risk warning labels to be added to alcoholic beverages. In an advisory released Friday, Dr. Vivek Murthy says that given the conclusive evidence on cancer risks from alcohol consumption, he recommends an update to the already existing warning label on alcoholic beverages to also include cancer risks.
Health warning labels are a proven strategy for raising awareness about harmful behaviors, but alcohol-related warnings often lack the specificity needed to highlight cancer risks effectively. However, despite mounting evidence of alcohol's role in causing cancer, the U.S. does not emphasize cancer-specific warnings on alcoholic beverages. Meanwhile, other countries are proactively informing consumers about these risks. Globally, 47 countries highlight health warning labels on alcohol, with some, like South Korea and Ireland, mandating cancer-specific warnings. The U.S. lags, despite alcohol being a Group 1 carcinogen, placing it alongside tobacco and asbestos in terms of cancer risk. Updating U.S. labeling laws could save lives by increasing awareness. 10. Number 1. Carcinogen. As highlighted by the U.S. Surgeon General Advisory, alcohol consumption is often seen as a harmless part of social life, but its role as a carcinogen places it in the same category as tobacco and asbestos. This reality demands urgent attention. Despite conclusive evidence linking alcohol to cancer, public health initiatives often fail to emphasize this connection. The consequences are significant, with preventable cancers continuing to claim lives every year. The International Agency for Research on Cancer classifies alcohol as a Group 1 carcinogen, the highest level of classification, alongside substances like tobacco and asbestos. This designation underscores the undeniable link between alcohol consumption and cancer, demanding stronger awareness campaigns and preventive measures. That is all for the 10 alarming statistics about alcohol-related cancer cases in the US and worldwide. Cancer prevention strategies are most effective when individuals understand how lifestyle choices impact their health. However, the complexity of alcohol-related cancer risks often leaves people uninformed. So, join us in the next video to understand the 5 lessons embossed in the U.S. Surgeon General Advisory that will motivate you to prioritize your health and strategize your lifestyle to be a better version of yourself.